Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
An ongoing cholera epidemic, which is sweeping war-ravaged Yemen, is believed to be the largest ever recorded in a single year. In just 3 months since the outbreak started, there have been more than 360,000 suspected cases. Yemen has become a breeding ground for the disease after 2 years of a devastating civil war that split the country between a Saudi-led government coalition and Iran-backed Houthi rebels. Few communities have been left untouched by the disease, but the worst-hit areas are controlled by Houthi rebels and suffer the most from a blockade of food and aid. Nawal al-Maghafi has been to the area in and around Hajjah province, where the outbreak started.
Another crisis has hit Yemen. People here question how much more they can take. War and poverty have combined to mean cholera has swept through this country faster than any on record. Unless treated quickly, this waterborne disease can kill. Most have walked hours to get treatment, but only the fortunate make it in time. Aid agencies are doing what they can, but the magnitude of this outbreak is outstripping their ability to respond. One person dies in Yemen every hour from cholera. This is the world's largest humanitarian crisis, and it's completely man-made. Pockets of famine are growing, cholera is spreading, and civil servants like the doctors and nurses here haven't received a salary in over 10 months. There's one thing that people here keep telling me, and it's that they feel completely forgotten by the world. People face the biggest threat in rural areas. In this one village alone, 20 people have died in the space of 3 months. Hours from the nearest town, it was impossible for people without money to get help. Abdullah has recently become sick. Together with his sister Hind, they can't afford the medicine for their illness. The truth is that for many in this country, there's no escaping cholera. Here on the edge of the village is the only source of water. The people know it's infected, but with no other options, they continue to rely on it. Nawal al-Maghafi, BBC News, Hajjah, Yemen.
Never have more people contracted cholera in a single year. Aid agencies say around 2,000 people in Yemen have already died in just 3 months. And there are fears the worst is not yet over. The war-ravaged health system means doctors haven't been able to stop the spread of the disease among nearly 400,000 people already weak from lack of food. Jane Deeth reports.
Abdullah made his mother Maleha proud. He went to school and always helped collect water. But he's gone, taken from her by cholera.
The day he was taken for treatment, he told me, "Don't worry, Mum, I can take care of myself, and tell Dad not to worry." When they brought him back, he wasn't talking, and he was still. I covered him, and it was the end.
Abdullah was probably infected by bacteria in the dirty water that's all the family has. Cholera causes diarrhea and vomiting, and it's the dehydration that kills. Dr. Ammar al-Mazgagi tries to save them, but too often the disease has moved too fast.
Some people might only have 2,000 Yemeni rial, or £5, and that's not enough to pay for transport, doctor's fees, and to buy medicine. This is why cases are rising. Children are getting worse and worse. People just wait before getting treatment, and things get worse until the child dies.
In another country, more people would be saved, with fluids and antibiotics delivered quickly. But this is Yemen, where war has levelled half the health clinics. Shia Houthi rebels drove the president out with Iran's help, according to its Sunni rival Saudi Arabia. A Saudi-led coalition is fighting the rebels with airstrikes. The UN says the warring sides and their proxies are to blame for this cholera epidemic, which it's feared will infect more than 600,000 people by the end of the year. It's spreading faster than during the world's biggest outbreak after the Haiti earthquake. There, the disease was introduced accidentally by UN peacekeepers and made worse by natural disaster. In Yemen, it's made worse by war. A UN vaccine plan was pulled because it was too late to do any good. The UK's pledged £139 million in aid, but it's made far more money selling arms to the Saudis, £280 million this year, according to Oxfam. The government says it's leading efforts to find a peaceful solution to the war, and arms exports are kept under careful and continual review. Maleha visits Abdullah's grave every day. A young boy killed by a disease spread by war.
Well, earlier I spoke to Dr. Meritxell Relaño from UNICEF, who's based in the Yemeni capital, Sana'a. I asked her about the terrible toll the outbreak is taking on the children of the country, with one child dying of the disease every 10 minutes.
It's terrible. There are so many factors that are contributing to the death of the children. The collapsing health system is one of them, where half of the health centers are closed. The doctors are not coming to the health facilities because they have not been paid in more than 10 months. In some areas, there is no doctors. It's a very complicated situation. In addition, there is lack of water and sanitation for more than 15 million people. There is rubbish in the streets. The situation is the perfect storm for a cholera outbreak like this one.
And there's also an additional tragedy that it could have been averted if you'd been able to get the vaccines in, couldn't it?
Well, it was a bit too late because the cholera outbreak spread too fast. Actually, we are having 385,000 cases actually only since April. So it went so fast and so out of control that now the epidemic is present in every district, basically every district in the country. Therefore, the vaccine is no longer efficient. But we are planning to bring the vaccine next year for a massive campaign.
But the Yemeni authorities asked for the vaccinations, and there was then a delay before the World Health Organization organised those vaccinations, wasn't there?
No, it wasn't like this exactly. It was the health authorities who changed their mind, actually.
So the Yemeni government?
Yes, because there were no enough technical possibilities to do the vaccine now, because, as I mentioned, the epidemic was spread already to most of the districts. So, therefore, it was quite an important economic and logistic effort for probably not very efficient campaign. Therefore, it was decided that it will be better if the campaign is postponed to later in the year or next year.
So, was there any more that UN agencies, charities could have done earlier, apart from the vaccination, to stop this getting out of control?
The situation here after 2 years of conflict is very difficult, with social services collapsing, health system, water, sanitation, etc. So this was going to happen sooner or later because the country is in a very dramatic state. The situation is so complicated that unless there is peace in the country, this kind of outbreaks can happen anytime.
And the terrible thing is that many participants in the West share some sort of blame for that conflict, don't they? I mean, the UK sends arms to Saudi Arabia, for example.
All parties in the conflict have a responsibility with what is happening in Yemen, definitely.
I mean, you in your job must be used to seeing cholera outbreaks after a natural disaster, but this is a man-made disaster, isn't it?
It has quite an influence, yes. It's a man-made disaster because if people had water, if people had clean water, if people had jobs, if there was any sort of income for the family, if this was a normal country, cholera is easily treatable and preventable.
Meritxell Relaño, thank you very much for joining us.
Thank you very much.